I'm Jennifer Chau. I've been practicing for about 11 years now. I originally started practicing in the San Marcos, New Braunfels area, lived in San Antonio for a little bit, and then came up to Austin about 8 years ago and started practicing here. I love it. I feel like there's so much stuff to do here. Like there's amazing food and hiking and concerts and sporting events. And I love that it's so central between like all the Texas cities. So it's easy to get to Dallas, Houston, San Antonio. There's just so much to do like every weekend. I think what sparked my passion for dentistry started honestly when I was a child. We grew up and visited some family in California a lot every summer. And my aunt is a dentist over there, and she would bring me into her office, let me kind of like watch her work. Second grade, I was already like, okay, I'm going to be a dentist. This is what I'm going to do, and just kind of like fuck with it. I think I love doing Invisalign the most just because it's really cool to see the before and the afters, being able to kind of educate the patients on that it's not just like a purely aesthetic thing, that it's also a functional kind of thing too. Educating them to know that, hey, if we put your teeth in the right alignment, that not only improves your smile, but it helps you be able to kind of keep everything a lot more clean. It helps with your occlusion, your bite, prevent just a lot more further like work down the line. I think the most fulfilling thing has been being able to coach and teach and mentor students, dental assistants and everything into the field. And so I've had people who hadn't had any type of experience whatsoever, but being able to kind of guide them and help them get into dental school and kind of seeing their whole like progression during that, graduating from dental school too. I think that's really cool to see. I love using the art and like intraoral scanner, being able to kind of show them what it would look like if they decided to go with Invisalign or cosmetic stuff. There's cool features on there where we just take like a profile picture of the patient and they can kind of see like where you're biting a lot heavier. It shows you your cavities. It shows you like your gum health. We can even send those scans to the patients. That way they can go home and take a look at those as well. I think a common would be that it is a scary place. One of the most fulfilling thing is to have a patient who is like very scared or very, anxious coming in and reassuring them on their first visit that like, hey, it's okay. Like we understand that it's not everyone's, favorite place to be, but it's rewarding to kind of see like they're smiling and not quite as like anxious. One of the main things that like Enamel we try to do is when they're coming in, like, we greet them, we give them a tour of the office. We have like headphones and Netflix and blankets and pillows as an experience like for them. So usually I'm a huge true crime junkie, but recently I've just been binge watching a chick flick on I think Amazon Prime. It's called The Summer I Turned Pretty. So I've just been binging that the past week or so. I love that we set aside, a good amount of time to be able to spend with patients. I think that's the biggest thing, especially on their, first initial patient. Being able to spend that time to get to know what they're here for, what they're wanting out of their visits, what their end goals are, but also getting to know, their family and what they like to do for fun and where they're going on vacation, those kind of things. If I had a superpower for my patients, I would create something that could numb without having to give anesthesia or needle. Patients would rate on that too, because I think that's one of the scarier parts for them. If I were a toothpaste flavor, I'm going to be just very simple, old school, just mint, just clean, fresh, that's it. Nothing crazy.